Hello and welcome to Don't Spill the Milk with Cindy and Lynette. This is Lynette.
Hello.
And I'm Cindy. We're really excited to talk to you today about ways our support people can help with feeding, right? There's
hmm
so many different ways that I can think of. I love this topic. I'm so excited to talk about it today. So, Lynette, what are some of the things that you suggest when you're working with parents?
Well, I think that a really great place to start is actually prenatally.
Mm-hmm.
Um, yeah, and having your partner come with you to your prenatal breastfeeding class or prenatal birth class,
Mm-hmm.
which both Cindy and I teach prenatal breastfeeding classes,
Mm-hmm.
breast and chest feeding classes. Um, And there's been studies done where when a partner is involved in breastfeeding and has fully supports their partner, then we see so much more success
Mm-hmm.
um, in.
The number one factor, isn't it,
Mhm.
in how breastfeeding, how long it goes and how well it goes is the
Yeah.
supportive partner. Yeah. And I think you're absolutely right. The prenatal period is the very best time to start engaging with becoming a parent, right? And
Yeah.
one of the basic things we need to do as parents is feed our baby. And if a family is choosing to breast or chest feed, typically, though not always, but typically it's only one of the parents who are doing the feeding,
Yeah.
and there's a lot that the other person can do to support them. So that breast or chest feeding class is so great because they're going to learn all kinds of really neat ways that they can
Yes.
help with getting the feedings off to a good start and then continuing them as long as they want to, right?
Yeah. And the
Yeah.
great thing is that when both parents are there, they're both getting the information because we both know
Yeah.
that once the baby's born, there's a lot of fog happening in mom's brain. And so the partner usually is a little bit clearer headed. And so they can remember things maybe that the feeding parent might not remember. And they can give reminders
Yeah.
of, hey, remember, this is how we get a good latch. Maybe I should pull down the chin a little bit, or maybe you should rotate baby a little bit to get into better position, so they can really help a lot being that teammate.
Absolutely. Yeah. Teamwork makes the dream work, right?
Mm-hmm.
And I think that you're completely right about that. That when learning to feed the baby, there are a lot of tiny little details to be aware of, a lot of little wee things to remember, a lot of instincts that guide you.
Yeah.
Um, but sometimes you just need a little reminder from someone who's maybe even seeing it from a slightly different angle, right?
Yeah.
So if I were to be feeding a baby, I'd be seeing the baby from here down. But somebody
Yeah.
looking from a slightly different angle might be able to say, oh, he needs to be tucked in this way. Don't forget to pull his bum in close, or
Yeah.
let's tilt his chin up a little bit. Remember what we
Mm-hmm.
learned in the class. So
Yeah.
yeah,
Or let's put this pillow over here because your
absolutely.
arm isn't resting on anything. It must be
Exactly.
getting tired.
Exactly, exactly. So those are some great ways that the partner. And here's the thing, I tell people this all the time. It makes you look like an absolute hero to tuck a pillow in under an arm that maybe the person didn't even realize was absolutely exhausted or getting a bit of a cramp in it or something, right? It makes you look like
Uh,
a hero. So it's really the best of all worlds, isn't it?
yeah.
Yeah.
So Cindy, what are some practical ways that the partner could help?
hmm There
Mm-hmm.
are lots of things that that partner can do to help things go more smoothly and be more pleasant. I'm all over the snack situation. So if Together, you can set up a nursing station or a nursing
Mm-hmm.
area or a couple of nursing areas in your house because you're going to want to move around a little bit probably that are comfortable with a table within arm's reach, not that you have to reach far over to get something. Um, a table on either side of your comfiest chair is nice because sometimes you're feeding in one arm and sometimes you're in the other arm, right?
Mm-hmm.
Um, and in those early days, once you get that perfect latch for the first time out of maybe the last 3 feedings, you don't necessarily want to lean over to get your water bottle. You don't want to move too much, right? You
Yeah.
get the hang of that after a little while, but um, bring snacks that they can eat with one hand. So a
Mm-hmm.
muffin, an apple, some cheese, something with fiber in it's usually a really good idea in that first week or two after a baby comes. Um, those are really practical things. And water, always, always, always make sure that the feeding parent
Yeah.
has a big bottle of water nearby, always. Yeah.
Mm-hmm.
Other practical things, maybe their phone, maybe a charger for their phone if they're desperately
Mm-hmm.
scrolling. Maybe make sure the remote control is nearby if it's a long cluster feeding session. Getting up in the middle of the night to help burp the baby and change
Yes.
the baby can give the nursing parent a little break or a chance to use the bathroom themselves or just a little bit of time without somebody in their arms, right? So,
Yeah, and sometimes parents find themselves doing a little bit more of a complicated type of feeding where they're maybe having to do some pumping, bottle
mhm,
feeding, and breast and chest feeding. And
yeah,
so it becomes really lengthy. And
yes,
so the partner can really take over those extra baby duties while the feeding parent does the pumping
yeah,
as well.
yeah.
Hmm.
And another great thing to do is holding the baby skin to skin. Babies like skin to
Mm,
skin with, well, pretty much anybody, but
yes.
generally with their parents or who's getting to do that skin to skin. So learning how to use a baby carrier is a really good
Yes.
thing because babies will settle in them really nicely. It gives you some really beautiful bonding time and it gives
Mhm.
the other parent either a chance to do what they need to do to take care of themselves or to facilitate the next feeding if that involves pumping or anything like that, right?
Yeah, that's right. And that's a really great segue
Yes,
into, join us next time when we're going to talk about bonding and how the other parent can bond with baby.
lots of ways that you can bond with baby that don't
Hmm.
involve actually feeding the baby. Okay,
All
we'll see
right.
you then.
See ya.
Bye.